Hello class, sorry I missed today. I am on my way to Dallas for a conference for the next 4 days in relation to my educational doctorate. So sorry I missed. However, in lieu of class, I have some assignments for you to complete. Again, please take advantage of this 2-hour window where you could complete part of this assignment as well. So one of the resources I will email you today will be this PowerPoint on chest pain. Then I'll also email you the unfolding case and describe or explain what I expect of the unfolding case, as well as some of the other homework assignments. So for this PowerPoint on chest pain, there's just a few things I would like to point out. Again, anatomy is going to be very important. So again, you may want to go back and review your anatomy of the heart and some probable causes of chest pain, which I'll point out today. Here are the objectives for this PowerPoint, and I want you to understand and remember that chest pain is categorized into 3 diagnostic groups: angina, atypical chest pain, and non-cardiac chest pain. In examining non-cardiac chest pain, I want you to consider some of these probable causes of non-cardiac chest pain that's pointed out by Fass and Navarro here in 2008. That was published in the Journal of Clinical Gastroenterology. And one of the big ones here is musculoskeletal disorders as a cause of non-cardiac chest pain. And one of the other big ones here is esophageal disorders, specifically GERD, gastroesophageal reflux disease, which again, I just want you to be cognizant of some of these non-cardiac chest pain causes or conditions. As well as I want you to understand this 5-organ system approach when you categorize or try to figure out what are some probable causes of chest pain. And again, I expect you to go into a little bit more detail and understand each one of these organ systems and the diseases or conditions that are affiliated with each one of them. And again, be aware that this is not a definitive list. Cardiac disease, I've included some probable causes of cardiac disease, GI disease, musculoskeletal disease, pulmonary disease, and psychiatric disorders, and all of these are some possible or probable causes of chest pain. As mentioned in class last week, I will introduce a variety of algorithms in here, and this first algorithm comes out of Sousa's textbook 2014 on initial screening algorithm for chest pain. And again, when we look at algorithms, I want you to think about and use it with the common phrase that I introduced last week: if this, then what? So when we look at this algorithm of chest pain, if a patient complains of chest pain and the pain is localized, I want you to think about, if the pain is localized, then you might want to assess if you can reproduce the pain with a stretch or a muscular contraction. And if you can, you may want to consider a specific muscle group or manage for a strain, myofascial, or trigger point referral for the underlying cause of that localized chest pain. If this, then what? Well, the patient presented with localized chest pain, but the pain wasn't producible, but they had a history of trauma, had shortness of breath, reproducible with compression. So if this, then you may want to consider pleurisy. And a procedure that you may want to perform is auscultate, and auscultate specifically for friction rubs. The other thing you may want to consider is performing Sheppelman's test to rule in or rule out pleurisy, and or you may want to take some imaging on your patients as well. So again, there's a higher systematic approach of things that you want to do with your patient. Maybe you want to order something, maybe you want to perform something, and then you want to order something as a confirmatory test. So again, as you go through this algorithm, I want you to think about, if the patient complains of chest pain and they have jaw pain, is it radiating? Is it localized? Is there a dermatomal pattern? Again, this is a great way of developing your cognitive skills of hypothetical-deductive reasoning. If this, then what? So again, I want you to review this. The other component is another diagnostic algorithm I've included in here, which I believe comes out of Sousa. And again, is looking at a variety of different cardiac conditions with clinical descriptors, and then it's going to help you hopefully develop your pattern recognition with this particular algorithm. And speaking of pattern recognition, pain patterns. How do patients present with specific pain patterns? Angina pectoris, myocardial infarction, pericarditis, pleuritic pain, GERD, anxiety. So again, when we try to enhance or develop our Systems 1 approach of pattern recognition, gut intuition, if a patient walked in the office with myocardial infarction, what would that particular pain pattern be? And how would your Systems 1 gut instinct clue into that and want you to maybe diagnose myocardial infarction and or prior to diagnosing, order some specific tests? So I will email everyone this PowerPoint, and the last thing in this PowerPoint are going to be some clinical scenarios. So I will encourage you to go through some of the clinical scenarios and just try to figure out what's going on with the patient. The other part that I've included in here are, again, alarm symptoms. If this, then what? If this, what would you want to consider? And then the other option is I've given you some values of likelihood ratios, sensitivities, and specificities of specific tests. I've given you descriptors of questions you may want to ask the patient. And if you phrase these particular questions, what would you be thinking about? Again, it's developing that higher order of thinking. So I will email everybody a copy of this PowerPoint. In regards to the handouts that Dr. Leduc gave you, there is a handout on a step-by-step procedure of what I expect of you and the assignments that I expect of you. So in regards to that, today hopefully she gave you this chest exercise. And this chest exercise, since we do have some time today, if you wanted to work on this collectively as a group, I would be more than happy to have you work as a group today once Dr. Leduc leaves for the time remaining, that you can complete this particular homework assignment. What I'm really looking here is for you to develop your pattern recognition, association, of if a patient presents with dullness, what type of examination procedure of the chest would you want to perform? Would you want to auscultate? Would you want to percuss? Would you want to palpate? If there were wheezes or hyperresonance, what type of examination method would be most effective for that particular clinical finding? So again, I'll have you map your Systems 1 to each one of these particular clinical clues or symptoms, and then again complete the matching for me. The other thing that I'm going to have you complete is what's known as an illness script. Now, illness scripts have been used in medical ed for a long time. I talked about illness scripts last week, where we look at the epidemiology of a condition, the temporal patterns associated with the condition, as well as syndromes, meaning manifestations or clinical clues, looking at sensitivity, specificity of specific tests for that condition that you may want to order that are going to strengthen your clinical rationale or your critical thinking for ordering a particular test to rule it in or rule it out. For example, a patient presents with an acute MI. If somebody presented with an acute MI, you may want to order troponin I. Or maybe order a CKMB, right? Creatine kinase MB fraction for the cardiac muscle, which we talked about last week. And when you do order that, that test has a sensitivity of 99% and a specificity of 98 and a likelihood ratio of 50. Now, likelihood ratio of 50 is really, really good, meaning there's solid, strong evidence that if I ordered a CKMB fraction and it gave me, It's a good clinical test to rule in MI is what I'm getting at. So what I'd like for you to do is for some of these conditions, or for all of them if possible, I want you to include some of these values of tests, of symptoms, of things that you'd want to order for this patient. Timing, talks about timing, is the timing short-lived, long-lived? Ethnicity, right? Is it more common in males and females? Sorry, ethnicity means, is it more common in African Americans or Caucasians? Is it more common in females or males? Is it more common in young individuals or older individuals? So I want you to incorporate a lot of these variables as you create your illness script. And finally, what I've done is I've given you a case scenario. And in that case scenario, what I would like you to do, there's going to be 2 emails that I will send everybody. One email will have the unfolding case part 1, which is this here. I expect everyone to read the little vignette that I have for you, answer these specific questions, and then you're going to submit a most likely diagnosis and give your clinical rationale. Again, do not open document number 2 until you've completed and submitted part 1. So what you can do is in the email that I will send you with the unfolding case for part 1, you can respond to me in that same email with your Word document answers. You will upload your Word document with your typed responses to that first email pertaining to case part 1. Then what I will do is I will email everyone part 2. So the second component of the unfolding case, again, in that particular email, I would like for you to, in the Word document, respond, save, upload it in the part 2 email, and return it to me. So hopefully that explains what I expect of you for this week, and next week we will definitely role play. I'll talk about these assignments. I will brainstorm and work through some of these assignments collectively as a group, and we'll just see how everybody's thinking. These unfolding cases are to be done individually. They are not a group assignment. The only group assignment I have is the chest exercise assignment. Again, if you have any questions, don't hesitate to ask or email or call me. With that said, please have a wonderful weekend. Enjoy your long weekend. And when I get back next week, we will discuss some additional things in regards to clinic and what I expect of you in regards to conducting clinical observations. So we'll talk about that next week. So once again, enjoy your Memorial Day weekend with barbecues and spending some quality time with your families. All right, take care. See you guys. Bye-bye.